Surprisingly, there are a lot of people who don't know how to wrap this blood pressure cuff properly, and just making a mistake here can easily cause your blood pressure reading to come out higher. And what I absolutely don't want you to do when measuring your blood pressure is rolling up your sleeves. Surprisingly, a lot of people actually do this. They forcefully push up their sleeves to expose their elbow and then measure their blood pressure. This is a no-go. Thank you for watching the video. This is YouTube Medical University. That blood pressure medication, you may not need it anymore. If that surprised you, keep listening. By measuring your blood pressure correctly at home, some people can reduce or even stop their medication. Many people like this come to my outpatient clinic. However, one mistaken measurement might mean needing more medication. I am a general practitioner in Hokkaido. I see patients with high blood pressure almost every day in my clinic. There's something I often see in these situations, Doctor. Some patients say, I measured my blood pressure at home, and show me their blood pressure log. When I look at the numbers, their blood pressure at home is mostly within the normal range. If their blood pressure is actually low at home, using the measurement method I'll talk about in this video, we can reconsider their medication. Some of you watching this video may have had high blood pressure at the hospital, or you might be taking blood pressure medication because your blood pressure was high during a health checkup. There are probably quite a few people who believe they have high blood pressure. However, when you measure it at home, blood pressure alone can predict future strokes and heart attacks. In today's lesson, I'll talk about 3 main topics. First period, 3 reasons why home blood pressure is important. Second period, the correct way to measure blood pressure according to the guidelines. Third period, I'll discuss common mistakes you make in a Q&A format, then cover something 90% of people get wrong in the second half of the video, such as how to choose a blood pressure monitor at an electronics store, or whether a blood pressure reading of 125/75 is really correct. I'll also discuss blood pressure measurement methods to avoid. If you watch this video until the end, you might be able to reduce the number of medications you need in the future, and by managing your blood pressure correctly, you should be able to lower your risk of diseases caused by clogged or ruptured blood vessels. Please be sure to watch until the end. At YouTube Medical University, we share medical information that will help you stay healthy starting tomorrow, from the perspective of a practicing doctor. Please subscribe to the channel now. Now, let's begin the first lesson. I'll explain 3 reasons why home blood pressure measurements are more important. If you want to know the specific measurement methods right away, please start watching from the second lesson. First, here's an important fact. Blood pressure measured in the exam room is also significant. But in the end, why do we lower blood pressure in the first place? Even if your blood pressure is high, it doesn't hurt or itch, right? Why do we manage it? It's to prevent future heart or brain disease caused by high blood pressure, right? And actually, it's not your blood pressure at the hospital, but your blood pressure at home that can predict the risk of these diseases. There's a world-renowned study from Japan about this. It's a study conducted in Iwate Prefecture involving Japanese people that has been ongoing since 1988. In this study, about 1,800 residents over the age of 40 were tracked using both home blood pressure and hospital blood pressure measurements. As a result, it turned out that blood pressure measured at home was better at predicting the risk of death in the future. And not only the risk of death, but also the risk of stroke. It has been found that home blood pressure measured at home, can predict these risks more strongly. In other words, it might be a mistake to start taking blood pressure medication just because your blood pressure was high when measured once at the hospital. That's why measuring your blood pressure at home is important for preventing future illnesses. This is the first reason why home blood pressure is important. And the second reason is white coat hypertension. Have you ever heard of white coat hypertension? When you measure your blood pressure at the hospital, it's around 150, but when you measure it at home, it's 120. This is actually called white coat hypertension. It's a phenomenon where seeing someone in a white coat at the hospital makes you nervous and your blood pressure goes up. In fact, there are reports that about 15% to 30% of people diagnosed with high blood pressure actually have white coat hypertension. In other words, for about 1 out of every 5 people, judging them as having high blood pressure based only on their blood pressure in the examination room, it's risky. You might end up increasing medications that aren't actually necessary. Even in the 2025 Japanese Hypertension Management Guidelines, it clearly states that management including home blood pressure is important. On the other hand, for those with white coat hypertension, whose blood pressure remains high no matter how many times or when it's measured at the hospital in that case, There are also studies suggesting that it may increase the risk of future heart attacks and strokes. A study conducted in America in 2019, along with 27 studies from around the world, analyzed about 60,000 people. It has been reported that if white coat hypertension is left untreated, the risk of heart and brain diseases increases by about 36%. So even if your blood pressure is temporarily high at the hospital, first, try measuring your blood pressure at home. If it's still high, work on your diet and exercise. If that doesn't help, consult your primary doctor and consider medication. It's important to manage your blood pressure properly, and if you're taking medication and managing it well, if your blood pressure is normal at home, even if it rises at the hospital because you get nervous, which is called white coat hypertension, it's said that it probably doesn't relate to your future risk of illness, so you might not need to worry too much if your blood pressure goes up at the hospital because you get nervous. And the third reason why your blood pressure at home is important is this: masked hypertension. Have you ever heard of it? Many people know about white coat hypertension, but masked hypertension, there are probably a lot of people who don't know about it. Literally, just like wearing a mask, you look fine at the hospital. You show good blood pressure readings. However, when you take off the mask, in other words, when you measure it at home, you might find that your blood pressure is actually higher than you expected. There are people like this. Maybe measuring it at the hospital gives you a sense of reassurance. Do you know why this is scary? There's one reason no one notices it. At the hospital, you check your blood pressure and wonder for the first time if it's high. Most people measure their blood pressure at home, so when they measure it at the hospital or during a health checkup, if your blood pressure readings are low, you wouldn't bother to buy a blood pressure monitor and measure it at home, right? It's also hard for doctors to notice. Since your blood pressure is normal at the hospital, you tend to assume everything is fine. However, there are reports that people with this masked hypertension actually have a higher risk of future illnesses. This is a Japanese study released in 2018. It targeted 4,300 Japanese people who are at risk of heart disease. They had participants measure their blood pressure at home twice every morning and evening, and then track their risk of developing illnesses afterward. As a result, the group with masked hypertension, meaning their blood pressure was high only at home, had twice the risk of developing heart disease or stroke. I think this is one of the typical patterns where someone who thought they were healthy suddenly collapses. And of course, there's really only one way to find people like this: measuring your blood pressure at home. Just because it's normal at the hospital doesn't mean you can relax. I've talked about 3 reasons why home blood pressure is so important. First, home blood pressure reflects your future risk better. Second, white coat hypertension can lead to unnecessary treatments. Third, masked hypertension can only be found at home. So, how can you measure your blood pressure correctly at home? I'll explain it clearly in the next section. Up to this point, I've emphasized just how important home blood pressure is. However, it's not just important to measure it at home, it's important to measure it correctly at home. If you measure it incorrectly, your blood pressure readings can easily change by 10 or even 20 points. You might think it's 140, but in reality, it's actually 120. To prevent that from happening, let's learn the correct way to measure it. I'll explain according to the 2025 Japanese Hypertension Guidelines. There are 4 key points: timing, posture, placement, and precautions during measurement. These are the 4. Now let's look at them one by one. The first is the timing of measurement. Which is more important, your morning or evening blood pressure? If I had to choose one, it's your morning blood pressure. This is the most important. That's because high blood pressure in the early morning is a better predictor of future health risks. There are 4 conditions for measuring blood pressure in the morning. Please screenshot, photograph, or write them down to remember. First, within 1 hour after waking up. Second, after you've used the bathroom. Third, before eating breakfast. Fourth, before taking any medication. It might sound difficult when you hear it like this, but don't worry, it's actually easy. When you wake up, go to the bathroom, then measure your blood pressure before having breakfast. If possible, after waking and using the bathroom, prepare breakfast before checking your blood pressure. It doesn't take long, right? Once you're done and have caught your breath, check your blood pressure before breakfast, then eat. I think this routine works well. Some people measure blood pressure right after waking up out of anxiety, but if you measure it before going to the bathroom, if you measure your blood pressure in that state, the upper value of your blood pressure can go up by about 5 for some people, and for others, it can increase by as much as 30. If it goes up by 30, you'll go over the line for high blood pressure, right? So you should measure your blood pressure after you've gone to the bathroom, and if you want to measure your blood pressure at night, when should you do it? At night, measure it before you go to bed. There are also some conditions for this. The first condition is to wait at least 30 minutes after eating dinner. Right after a meal, blood flow is directed to your stomach and intestines, which causes large fluctuations in your blood pressure. And there's one more surprising thing, taking a bath. After taking a bath, please wait at least 1 hour before measuring your blood pressure. Why is that? In the past, it was said that 30 minutes after bathing was enough, but the latest recommendations say that the effects of bathing only disappear after 1 hour. Why does bathing matter? It's because when you take a bath and get overheated, you can become dehydrated. Because of that, some people experience a drop in blood pressure. This is especially important for elderly people, but after bathing, there are also people whose blood pressure rises due to such activity. So please remember that your blood pressure can fluctuate easily. That's why before measuring your blood pressure at night, remember to eat dinner and take a bath, then wait for a while and measure it before going to bed. Now, the second of the 4 important things to keep in mind about blood pressure. What posture do you think is best for measuring it? This is directly related to your blood pressure readings. There are 4 key points. First, sit on a chair and lean back lightly against the backrest. Second, don't cross your legs and make sure the soles of your feet are firmly on the floor. Third, keep your arm at the same height as your heart. Fourth, support your arm. Don't let it hang down. Let's go through each of these one by one. For example, if you're lying in bed or if you measure your blood pressure sitting in seiza on the floor, that's incorrect. Sit back in a regular chair with your back against the backrest for proper posture. Second, don't cross your legs. Keep the soles of your feet flat on the floor. In fact, it's said that just crossing your legs can raise your blood pressure by an average of 2 to 8 points. Also, it's not good if your feet are dangling. Having them flat on the floor is the most relaxed position. Third, pay attention to the height of your arm. Make sure the position where you wrap the blood pressure cuff is at the same height as your heart. If the desk is too low and you measure your blood pressure with your arm hanging down, your arm may stay tense and your blood pressure reading may come out higher. On the other hand, if you lift your elbow too high and measure at a higher position, your blood pressure tends to be lower. So if your table is low, use something like a book or a cushion to help you relax and raise your arm. Place something like that under your elbow and rest your arm on it when you measure. And the fourth point is to make sure you don't tense your arm. If possible, do the same with your other arm. Instead of letting it hang loosely, place your other hand on your knee or on the table and keep a relaxed posture. And the third of the 4 points for measuring blood pressure is how to wrap the cuff. The cuff is the part of the blood pressure monitor you wrap around your arm, and how you wrap it matters. Many people don't know this, and just making a mistake here can cause your blood pressure to read higher. There are 4 key points to wrapping the cuff correctly. First, wrap it 2 to 3 centimeters above your elbow. Second, align the arrow on the cuff with the inside of your arm. Third, wrap it loosely enough so that you can fit 2 or 3 fingers under it. Fourth, wrap it over thin clothing or directly on your bare skin. How about it? Are you paying proper attention to this? If the cuff is placed over your elbow joint, you won't be able to measure your blood pressure correctly. The blood pressure monitor works by using air pressure to squeeze the blood vessel on the inside of your arm and checking how much pressure needs to be released before the blood flow returns. So if you don't align the arrow with the inside of your arm, you won't be measuring the blood vessel that runs along the inside of your arm in the first place. You won't be able to compress and squeeze the blood vessel properly. It's easier to understand when you think about the reason behind it, so always make sure to wrap the cuff so that the arrow is pointing to the inside of your arm. When wrapping it, leave it loose enough for 2 fingers to fit under the cuff. If it's too tight from the start, you won't be able to measure accurately. Also, if you try to measure your blood pressure over a thick sweater or something similar, the sweater acts as a cushion and makes it hard to properly compress the blood vessel, so your blood pressure reading is likely to be incorrect. And something you absolutely shouldn't do when measuring blood pressure is rolling up your sleeves. Surprisingly, a lot of people actually do this. Pulling your sleeve up forcefully to expose your elbow and then measuring your blood pressure, this is a no-go. The reason is, when you roll up your sleeve, the base of your upper arm gets squeezed tightly by your clothing, which can restrict blood flow. So even though blood pressure is supposed to be measured by properly compressing the blood flow with the cuff, if you roll up your sleeve and squeeze the upper part of your arm, it can cause your blood pressure reading to be falsely high. Huh? If you've done this too, please let me know in the comments. Starting tomorrow, unless you're wearing a thick sweater, measure your blood pressure with your sleeve down or after taking off your top. Please remember this. And the fourth point is things to be careful about during measurement. There are 3 of these. The first is not to talk. Please don't measure your blood pressure while talking with friends or worrying out loud about what to do if your blood pressure is high. Data shows that simply talking can raise your blood pressure by 4 to 19 points. Also, turn off your smartphone and TV. Avoid measuring blood pressure while using your phone or watching TV. Is there anyone measuring their blood pressure like that? The guidelines clearly state that blood pressure should be measured in a quiet environment, so please be careful. And third, before measuring, take deep breaths for about 1 to 2 minutes and relax. As a guideline, after sitting in the chair to measure your blood pressure, try taking 5 to 6 deep breaths. Take slow, deep breaths like this, and then press the button to measure your blood pressure. Just by doing this, your blood pressure readings will be much more stable. That's the correct way to measure your blood pressure. Everyone, were you able to do it perfectly? Please share in the comments any points you weren't able to do correctly. And if you have any questions, feel free to leave a comment. I answer all of them. Up to this point, what we've covered is the correct way to measure your blood pressure at home, according to the guidelines. After waking up, go to the bathroom, sit in the correct posture, take a deep breath, and then measure. Please continue this routine every night and every day. However, even if you measure perfectly up to this point, if you make a mistake in how you record the results, everything will be ruined. In particular, 90% of people make mistakes at electronic stores. How to choose a blood pressure monitor. And in the third part, I will explain the true meaning of the target blood pressure value of 125/75. So in the third part, I will explain the points that I am often asked about in my outpatient clinic and the points that patients often get wrong in a Q&A format. First question, is it okay to just write down the lowest value after measuring several times? I get this kind of question too. How about you all? There are people who confidently tell me, "Doctor, I measured it many times at home and wrote down the lowest value," but actually this is a mistake. According to the latest guidelines in Japan, this is how you should record your blood pressure. Measure it twice and write down the average value. This is the rule, so instead of measuring twice and choosing the lower value, please measure twice and record the average value. For example, if your systolic blood pressure is 135 the first time and 125 the second time, you should write down the average, which is 130. And one more important thing, if possible, please record all the values you measure. Write down both the good and the bad values. This information is very important for us doctors to make the right decisions. If you only write down the high values because you're worried, or if you measure several times and only record the lowest value, we won't be able to make the right decisions. So please be careful about this. Q&A. Second question, which is better, a wrist type or an upper arm type blood pressure monitor? This is something you're probably curious about, right? When you go to an electronic store, the wrist type ones are more compact and cheaper, aren't they? I think it's natural to want to buy those. However, to give you my conclusion first, I still recommend the upper arm type. According to the guidelines of the American Heart Association, AHA, wrist-type blood pressure monitors are not recommended. And Japanese guidelines also recommend the upper arm type. Some of you might be wondering why I'm saying this so strongly. There are 4 reasons. The first is that with the wrist type, the bones get in the way. Actually, the blood vessels in the upper arm are surrounded by soft fat and muscle, so when you tighten the cuff of the blood pressure monitor, the blood vessels are compressed nicely. But what about the wrist? In the wrist, there are hard bones right underneath. And around the blood vessels, there are a lot of tough tendon-like fibers running through, so even if you wrap the cuff, the blood vessels don't get compressed evenly. In other words, if the blood vessels can't be compressed accurately, you can't measure blood pressure accurately. And the second reason, blood pressure at the wrist tends to be higher than at the upper arm. Isn't that surprising? You might think that the farther you get from the heart, you'd expect blood pressure to go down. But actually, that's not the case. The wave of blood pushed out from the heart travels all the way to the extremities and then bounces back from the extremities and returns. In fact, blood pressure tends to be higher at the wrist. Specifically, there are even reports that blood pressure at the wrist is on average about 5 units higher than at the upper arm. And the third reason, it's difficult to keep your wrist at the same height as your heart. With an upper arm monitor, you usually rest your elbow on the table, so your elbow naturally ends up at the same height as your heart. But with a wrist monitor, if you measure in the same posture, your wrist ends up higher than your heart, right? For example, if you measure your blood pressure 10 centimeters above your heart, the reading will be on average 8 units lower. On the other hand, if you lower your hand and measure 10 centimeters below your heart, your blood pressure will read on average 8 units higher. And the fourth reason is surprising. For people with arteriosclerosis, wrist measurements tend to show even higher readings. This is actually serious. When arteriosclerosis progresses, in other words, people who have issues like diabetes, cholesterol, or blood pressure, and as a result have arteriosclerosis, actually tend to have a bigger difference in blood pressure between the upper arm and the wrist. In other words, as you get older, arteriosclerosis progresses. So the older you are, the more you should measure your blood pressure on your upper arm rather than your wrist. Of course, if price or convenience is an issue and you can only use a wrist monitor, it's still better to measure than not to measure at all. However, if you're considering buying a new one, please try to choose a blood pressure monitor that measures on the upper arm if possible. Question 3. Which arm should I use to measure my blood pressure? This is actually a question I get asked a lot. I always answer like this. If possible, please try measuring on both arms at first. Then I suggest measuring daily on the arm where your blood pressure was higher. In fact, the guidelines also recommend measuring on both arms at first. And actually, measuring on both arms is important. If there is a difference of 20 or more in blood pressure between your left and right arms, what do you think this means? It could be that a difference in blood pressure means that the aorta, which is the largest artery, is torn. The blood flow in one arm may be poor, or the blood vessel may actually be narrowed due to arteriosclerosis, causing poor blood flow. If you overlook this, you might miss a life-threatening disease. And why do we have to measure blood pressure on the arm with the higher reading? You might think it's just because we want to prescribe blood pressure medication, but that's not the case. If there's a blood pressure difference between arms, the correct value is actually the higher blood pressure reading. The higher blood pressure should reflect the pressure in all the blood vessels throughout your body, so please make sure to measure your blood pressure every day on the arm that gives the higher reading. And now, the fourth and final question. In the end, what are the standard values for blood pressure and the diagnostic criteria for hypertension? There are various target and standard values for blood pressure, but I think it's enough to remember just two. Think of blood pressure numbers as having a threshold and a goal. The threshold refers to the standard value used to diagnose hypertension. It's important to measure your blood pressure at home, right? For home measurements, the standard is 135/85. If your blood pressure exceeds this, it is generally considered hypertension. Now, what do the entry and goal numbers mean? They refer to the target values you should aim for through lifestyle changes such as diet and exercise, or with medication. The target value is a home blood pressure of 125/75 or lower. So let's remember these two numbers. If your home blood pressure exceeds 135/85, that's considered hypertension. For those people, the target value to aim for is 125/75. Please make a note of this. These values are important for preventing future strokes and heart attacks. Of course, this doesn't apply to everyone. It depends on factors such as chronic illnesses, age, and a history of fainting from low blood pressure. Taking those things into consideration, sometimes the target values are decided individually, so don't just take this at face value. Be sure to discuss with your primary doctor and decide on your target values together. Now, let's summarize today's lesson. There are 3 important reasons for monitoring blood pressure at home. First, home blood pressure reflects future risks better. Second, white coat hypertension can lead to unnecessary treatments. Third, masked hypertension can only be detected at home. In the second part, I explained the right way to measure it. Check your blood pressure after waking up and using the bathroom in the morning. After that, have your breakfast. If you're measuring at night, do it before going to bed. Make sure to wait at least 30 minutes after dinner and 1 hour after taking a bath before measuring. When measuring, sit back in a chair with a backrest. Don't cross your legs, keep your arm at heart level, and start measuring after taking 5 or 6 deep breaths without talking. For recording, measure twice and record the average value. I also told you about common mistakes people tend to make. It's not good to only choose and write down the lower values. Record everything and make your judgment based on the average. If possible, buy an upper arm blood pressure monitor, not a wrist type one, and measure above the elbow, measure on both arms, and use the higher value for your daily measurements. And for blood pressure values, a home blood pressure reading of 135/85 is the threshold for diagnosing high blood pressure, and the treatment goal is 125/75. If you judge only by blood pressure measured at the hospital, you might miss white coat hypertension or masked hypertension. Blood pressure measured at home is more important for predicting future illnesses, so please make sure to show your doctor the blood pressure readings you measured correctly at home. You might be able to stop taking medication, or you might be able to reduce it. This will be the first step toward changing your future, and I have a request. If you plan to measure your blood pressure correctly, comment that you'll check it twice daily, morning and evening, starting tomorrow. Your declarations will encourage others who have the same concerns. Also, I have one announcement. I have prepared a handout that summarizes today's lesson on EA4 page, When Should You Measure? How Should You Sit? What should you avoid? By putting this sheet on your fridge, your daily blood pressure readings will naturally get more accurate. I've made a sheet like that. Please add the official LINE account in the description and type in the 4 characters Iketsu to send. Then we will immediately send you the materials for free. And if you found this video even a little bit helpful, I'd be happy if you could give it a thumbs up. Also, before you forget which channel this is, I'd appreciate it if you could subscribe and hit the notification bell now. Well then, see you in the next video. As a general practitioner, my patients have taught me how to live well from your 70s onward. This book shares stories from patients who inspired me with, I want to live like this, and I never knew you could live this way. I've learned from my elders that chatting with friends matters more than exercise, and sometimes less medicine is better. At any age, you can live a healthy, happy life. It's packed with all kinds of wisdom. Please check it out via the link in the description.